Good afternoon, everyone. Thank you for joining this, the third of the end of DBOT 2019-2020 webinars. Today's focus is on EHC and outcomes training. We have already delivered webinars on focusing on JSNAs and outcomes-based commissioning, and I will include the links to those when I send out the recording and slides from this presentation today. My name is Philippa Watts. I am the Senior Programmes Officer for Health at the Council for Disabled Children, and I will be taking you through a very, very brief, very condensed overview of our EHC and outcomes training today. I've had an enormous number of people signing up for this, which is fantastic. I can see there are 99 of you there at the moment, which I think is my biggest ever audience. But anyone who has signed up to this webinar and is unable to attend now will automatically get the recording, and I will share the link with everyone. So please do feel free to share it with colleagues who haven't signed up to this. It should be easy to pass around. So I'm going to start this webinar off with an overview of what has been delivered in the DBOT 2019-2020 contract. For anyone who isn't sure what DBOT stands for, it is Delivering Better Outcomes Together, which is the DfE-funded programme delivered by us at CDC, along with colleagues at NDTI and Mott MacDonald. This contract involves a number of different elements of support, including regional events, bespoke local area support, accelerated working groups, and training sessions. We are now looking ahead, I may as well say this at this point, looking ahead to the 2020-2021 contract, which will start. We're still thrashing out the details, obviously tricky time for DfE, so we appreciate that colleagues there are a little under pressure, but we are anticipating that a very similar model will be available next year. So if in the course of this session you think, oh, actually we really could do with this training in full, please do get in touch. I'm keeping a log of people who are interested in support going forward, and we will pick that up when the contract rolls over. So I'll give a brief overview of sort of general learning from the year so far, and then I'll give you what you are mostly here to hear, which is a summary of our outcomes in education, health and care plans training, and also I'll pick up on some of the common themes that we've found in the course of delivering this training. It is one of our most requested support elements, so we've got plenty of learning that we can share with you there. So what have we done in DBOT this year? Each of the 9 regions have the opportunity, and I should say before I start this, apologies to those of you who are my loyal followers, and now this is the 3rd time that they have heard this overview. Do bear with me very briefly if you've already watched the 1st and 2nd of these webinars. This hasn't changed much. So we've had offers to each of the 9 regions in England for a regional workshop on a theme of their choice. So those 4 themes that we've offered have been aligning different programs. So that's looking at the 4 key strategic change programs, the SEND reforms, personalised care, transforming care, now known as learning disability and autism, and the NHS long-term plan, and how we can bring those into alignment to improve efficiency across the system. And then we've had data and information sharing, which is looking at sort of, as it says on the tin, how we use improve and strengthen the data collection that we have, and how we share information better between different agencies to get a fuller picture of the lives of the children and young people in our areas. That's led to the development of the 0 to 25 data dashboard, which if you haven't seen that yet, I will include links to when I follow up with this. As you see, aligning different programs has been the most popular one, with data and information sharing also there. And we had also offered support on outcomes-based commissioning, which sort of got taken up by Yorkshire and Humberside, who wanted to connect the data with the strategic outcomes. And we also offered personalisation, which nobody took up. We had the alternative option of a bespoke alternative. So the East of England asked for a region-wide analysis of JSNAs, which we did, and have developed another resource out of with recommendations for developing good JSNAs and some case study examples. That's just waiting for final sign-off, and then we will be able to share that with you as we go forward. Sorry, I'm just keeping an eye on the chat box. Just a couple of people. Sorry, just there we go. If you do have questions in the chat box, please do drop them in. I will keep an eye on them as I can, but it is just me, so apologies if I have to pause a second to take those. I will plow on as much as I can, and if you do have questions at the end, I will leave my contact details, and you're welcome to get in touch. So what have we learned from these regional events? There is lots of good stuff out there. All of you, in whatever areas that you're working in, oh, I've got people saying they're not supposed to be seeing my screen. Oh, apologies, everyone. Now you should be able to see my screen. Is that working better for you? Those of you, there we go. All right. Thanks, Alison and Matthew. My apologies. This is my third virtual event of today. You'd think I'd have got into the swing of it by now. But there we go. So there are pockets of good practice in all the areas that you're working in, whatever they may be. And some things, what we're hearing is that while there is a lot of good work going on, it's not necessarily being celebrated and shouted about. So we really would encourage you to share proactively about the things that are going well. And we know that not everything will be perfect, but when things are going well and you're seeing improvements and you're making innovative changes, do let us know. And we're always looking for more case studies to share examples of good practice. We're hearing a lot that relationships between agencies are improving, that communication is getting better, and we're getting more people around the table, and lots of as a result of that, or partially as a contributor to that, lots of pathways are under review, lots of people looking at their neurodevelopmental pathways, speech and language pathways, and so on. We know that visionary leadership leads to cultural change, and we've certainly worked with some areas where it's really, really being driven from the top, and that's what motivates others, and that's what supports others, going, right down to the ground and down to families to have a really positive experience, and to shift that mentality from looking at what we do and what we deliver from those outputs to focusing on outcomes and actually how are we making things better for children and young people in our areas. We know that multidisciplinary team panels are working well when they're in place. They are tricky, but there are some good examples of areas out there who are doing this well, and I'll include links to various case studies that we have for multidisciplinary work in a number of different areas. Of course, there are still a lot of challenges. These will be very, very familiar to you all, no doubt. There are still conflicts over funding. We're still working in a very, very difficult financial environment. Transition can still be a cliff edge. Things are getting better. We're hearing some good examples from people, but we know that getting adult services around the table is still very difficult. And given the constraints that we're working in, there's some reluctance to take positive risks, and innovative approaches and strategies can be discouraged. We hear a lot that parental choice is still lacking. Personal budgets aren't necessarily working as well as they might do, and even when they're in place, there aren't the options to spend that money in the way that families would like to. Capacity and staff turnover is a massive issue at all levels, at strategic level, all the way down to practitioner level. And there's a lot of issues around infrastructure, particularly IT. So those are the sort of themes and challenges that go across the piece, sort of whatever area you're working in, whichever change programs you are involved in. I've mentioned the CDC Bespoke Support that can help with some of these challenges. So this year we have had in the contract, we've been able to support mostly areas with a written statement of action, but also a smaller pot of days for those who either haven't yet been inspected or who have been inspected and haven't been obliged to write a written statement of action, but still want some support with some difficult areas. As I say, we're still thrashing out the details of these for next year. There will still be bespoke support available. It's looking increasingly likely that that is going to be leaning even more heavily towards areas who do have a written statement of action, but there will be some support available to a greater or lesser degree. So as I said, do get in touch if you would like this outcomes training or any other support, and I will pick that up in April. Just a quick run through of some of the things that different areas have asked for. The development of a high-level outcomes framework. We've done quite a number of those now. I think I've done 8 or 9 in the last sort of 5 or 6 months. And then also there might be areas that have a high-level outcomes framework but haven't quite implemented it. So we've done some work on how we connect the sort of individual outcomes, service level outcomes up to the high-level outcomes framework. Those have been really, really positive days, and we're just developing a case study with Stockport, who we've worked quite closely with on sort of giving it an overview of their process and what they're anticipating to come out of it, which we shall get to you as soon as possible. I'm hoping to get to that by the end of the week. The EHC plans and outcomes training, which is what you're all here to hear about today, had lots and lots and lots of requests for that. So again, as I say, if this makes you think you need that more focused approach in your area, do let me know. A number of areas who have been looking at their neurodevelopmental diagnostic pathways. We've been building on the St Helens model that we developed a case study on last year, and supporting other areas to develop their pathways and improve their sort of package and communication with parents around neurodevelopmental diagnostic pathways. We've done numerous reviews of training strategies and policies. We've supported a couple of areas with peer challenge reviews, and also some sort of less formal peer challenge review style days where we've facilitated conversations around particular areas of challenge, and as already mentioned, the JSNA analysis. Sort of just very quick summary of our learning. Nobody is alone. If you are facing a challenge, there are definitely hundreds of others out there who are facing the same challenge. And as I say, this proactive sharing is really crucial to help us understand this and overcome it. I mentioned already most of these: financial pressures, staff turnover, ownership of strategic outcomes. This is interesting. If you are more interested in those strategic outcomes, do catch up on that webinar. Sorry, again, the chat box. Do catch up on that webinar. That gives you an overview of that process. And there is an appetite for a standardized EHC plan. Okay, so getting into the meat of today, the focus on outcomes and EHC plans. I just want to set some expectations before I start going into this. This is a very, very, very condensed version of this training. This is ordinarily a full day training, multi-agency setting, sort of between 35 and 50 people from a local area working together. It's very activity focused. It's very based around discussion and conversations and understanding different perspectives of different teams and different individuals. And we all do strive to include parents and carers in that as far as possible as well. And while the morning is sort of more classic training, I suppose, with sharing of best practice and some activities, the afternoon session focuses on reviewing the local area process and the templates that are used in the EHC process. So looking at, given the best practice that we've learned about in the morning and sort of confirmed in the morning, do the processes in our local area enable us to perform this best practice? And quite often the answer is no. So we do a little bit of action planning around, okay, we're understanding now where the sticking points are, but we're also understanding what's going well, and how can we strengthen those areas that need a little bit more work. So it's really vital that when you do this in full, we have senior leaders in the room so that they can take away this learning and drive forward change at that strategic level, at the process level, to improve experience for everyone involved, practitioners and families as well. So we're obviously not going to be able to do that today. So what I am going to be able to do is give you a sort of very quick summary of what we cover in the training and the discussions that we would have. And then I will give you some key learning from those discussions from other areas. I won't be naming and shaming anyone, just some sort of key themes that come up that are recurring in these discussions. So this is the standard agenda. We usually start I mean, the timings can be shifted. That's not necessarily a focal point for today, but we start by thinking about aspirations and what are aspirations to children and young people, and how do they fit into the EHC plan as the golden thread that runs through that plan. Then we move on to thinking about outcomes. This I will give you a reasonable amount of this morning, sort of the research around outcomes and what that means for children and young people, sort of from their perspective, and then we talk about the actual process and how does the process support the development of those outcomes and how do practitioners feed into that. Then we look at some of the legal considerations. Now, I'm not going to go through this today because that really is just refreshing memories on things that can be found in the code of practice and things that can be found in the guidance. I will share with you various resources that CDC have put together around this, but this it's just a sort of a memory jogger, that session there, getting anyone on board who is new to the system. As we know, with that turnover, that there's a lot of change in staffing. And then we have the I'm getting messages that people can't hear. Is that a wide problem? Or is that just a couple of people? You drop me a note in the chat box if you can still hear me. If I'm talking to myself, it's hard to know. Okay. No, thank you. Thanks everyone for getting back to me. That's fine. And then, as I said, there's the action planning and next steps. So that's, again, very specific to that particular area that we'll be working in. Okay, so our very quick whistle-stop tour. This is sort of the introductory session, focusing on the Children and Families Act, which I'm sure many of you will be very, very well versed in, but we do find that not everyone is, so it's worth really going back to basics just very quickly. What we know from prior to the Children and Families Act, that there have been historically very low expectations and aspirations for children and young people with SEND. Their outcomes have been very poor in terms of physical health, mental health, involvement in the community, and progressing towards adulthood and living a sort of full and satisfying life. We know that that is less the case for those who have SEND. Nobody wants this picture. This isn't something that anybody is aiming for. And the Children and Families Act, of course, came in to look at turning that around. So the focus in the Act is around improving aspirations, raising aspirations for those children and young people, being really person-centered, with professionals and practitioners working together, commissioning together, and creating sort of real wraparound around the individual, rather than working in silos. And if we do this and we do it well, then this will lead to better outcomes for individuals and families. So thinking about aspirations very quickly. I'd like you actually all to just have a think. What are your own aspirations? Drop me a note in the chat box of what your own aspirations for your personal life are. Mine is to get a dog. If that gives you a flavour, drop me something really personal, not too personal. I'm gonna read a couple of these out if you don't mind. To be happy, it's a lovely one. To get fit, now's a good opportunity. Get your home gym going. I've got a very small flat. Been yogaing and all sorts of things all over the place. Finish my PhD. Another one, wanting a dog. Oh, outrageously happy. I like that one. Finish building my forever home, she says from her caravan. So I think this illustrates, yeah, want a doggy, wants to buy a house. Yeah, I'm in that boat. I think this illustrates really nicely the really broad variety of aspirations that any of us have. Let alone for children and young people with SEND, and we shouldn't limit their aspirations in any way that we would limit our own or those of our children or those of our friends at all either. At this point, we would usually show a really cute video of some young children talking about their aspirations, but in the interest of time, I'm afraid I'm going to save it. I will send you the link though, it's adorable. Here are some examples of aspirations from real EHC plans. Some of them are very familiar, no doubt all of them very familiar, I would imagine, from children and young people that you know. I just want to highlight that one on the bottom right. I want to be a butterfly. Is it okay to want to be a butterfly? Absolutely it is. I can't think of a better thing to want to do on this sunny afternoon than be a butterfly. flapping around the garden. Absolutely, yes. We wouldn't tell a non-disabled child that they couldn't be a butterfly, and neither should we be doing that for disabled children. And I just want to highlight this particular example. The practitioners who are working with this young girl who said this did a little bit of digging and trying to work out actually what was it that she really wanted. What is packaged up in this wanting to be a butterfly? And she found that she had a one-to-one TA at school who was really stuck to her side and was really sort of limiting her ability to be free and play freely with her friends and move freely. And she felt that butterflies had that freedom to move that she didn't have because she had that TA stuck to her side. So I think one of the key takeaways for me here is that we really need to dig into what it is that children and young people's aspirations really mean to them deep down. And that takes time, having those kinds of conversations. And of course, those who are non-verbal or use alternative augmented communication methods, there are resources to help you have those conversations, and I'll include links to some of those in the notes at the end. Then we move on to outcomes, and we have some resources with some sort of more examples that we use during the day. But then we move on to outcomes and we think about, okay, I'd like you now to come back to thinking about your aspiration that you very kindly shared with me. What sort of outcomes do you need to get there? So if I want to have a dog, if that's my end aspiration, in order to get there, I need to have an income that enables me to support the dog, a bit more space. I do need a bigger house in order to have the dog. Talk my husband into getting a dog. Obviously, this is really this is resonating. This dog anecdote. Sue is saying time and training, managing work-life balance. Yeah, so some good examples here of sort of the interim steps that we all need to get towards whatever our ambitions are in life, recognizing responsibilities. And so they're clearly different to aspirations. Aspirations are that end goal, that hope, that dream, and outcomes are the steps that we need to take to get towards that goal. So here are some examples. This is an activity that we use in the full training. Here are some examples of outcomes that we have seen in EHC plans. And what I would like you to do, I'm going to go through these one by one. And you should have on your panel, you should have a little hand button that some of you have already used to indicate that you're having some issues. I'm going to go through these one by one, and could you click your little hand button? I'm going to put all of your hand buttons down because I have the power to do that. And if it is an outcome, please put your hand up. If it is not an outcome, drop me a line in the chat box as to what it is instead. So number one, Liam will be able to go out with friends. Put your hand up if that is an outcome. Yeah, we've got a good number of responses saying yes, 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 yes. Yes, that is an outcome. I should just say, actually, none of these are smart. We are aware that none of these are smart, but just let's sort of look at it conceptually before we get into the details. Okay, I can put all your hands down. Number two, Tracy will be in school more. Is that an outcome? You've got a number of hands going up. Yeah. This one's a little bit contentious because outcomes do need to be in line with what the child or young person wants. This depends very much on Tracy's situation. There are some children, young people who absolutely do want to be in school more. There are some children, young people for whom school is very difficult for whatever reason, and that outcome may be driven more from a parent perspective or from a practitioner perspective. So that would depend very much on Tracy's personal context. Okay, hands up for number 3, 3 hours of speech and language therapy a week. Is it an outcome? I'm seeing a lot going up there. This is not an outcome. This is a description of provision. I can't imagine any child thinking, oh, my hope and dream is to be an astronaut, and therefore I really, really want 3 hours of speech and language therapy a week. They might find that they want to improve their communication. That's one thing. But that is very unlikely to be an outcome that a child or young person sees for themselves. That is a description of provision. Number 4, to be able to communicate with my friends at playtime. Plenty of hands going up there. Yes, that is an outcome. So that's sort of the flip side of number 3. That's the so what of the 3 hours of speech and language therapy, really, isn't it? That's the as a result of that speech and language therapy, I would be able to communicate with my friends at playtime. Number 5, to enjoy school. Again, lots of hands going up there. I really like this one, actually. I think it is an outcome. I think it is an outcome, and this is, you can sort of see what might underpin that about social relationships, about accessing in the classroom, about not being bullied, about being fully included. So yes, that is an outcome. Number 6, Tracy has difficulty communicating with her peers. Put your hand up if you think it's an outcome. Lot fewer there. That is not an outcome. That is a description of need. That doesn't tell us Tracy is not, wishing and hoping that she will have difficulty communicating with her peers. That seems very unlikely. That is a description of of Tracy's situation and need. So the outcome might be to be able to communicate with my friends at playtime. And the provision for that might be 3 hours of speech and language therapy a week in order to combat that difficulty communicating with her peers. Number 7. Oh, I've put the hands down. There we go. I will be able to travel on my own when I go to secondary school. All those have gone up very quickly, very, very quickly indeed. Yes, that is an outcome. I will be able to travel on my own when I go to secondary school. All right. So I've got another list of those. Rather than going through them one by one, I'm just going to give you just a moment to have a look at them and have a think for yourself. Just for a second. Then I will just pick up on 1 or 2 there that sort of stand out. Okay, the first one that I want to pick on there is to get an EHC plan. That was genuinely written in a child's EHC plan as an outcome for them to get an EHC plan. I've got some questions here about language. We'll come back to those, Jeff. An EHC plan is, that's, sort of supporting provision. That's not an outcome. I can't imagine any child thinking about their future and thinking, oh, I'd really love to have an EHC plan. That is the enabler that allows them to achieve their outcomes. The other one I want to pick up on is number 13. Hardeep will be able to read 10 new words by half term. This is a target. The difference between this and an outcome is that half term, firstly, is too short a time frame. When we're talking about outcomes, we're usually talking about a key stage, so a couple of years, something that is stretching this child or young person, and it's also likely to be too achievable. It's just too quick, and if you're having to redo outcomes, every time a child or young person achieves something at that level, you're going to find yourself very, very busy indeed. And then number 14, John gets 15 hours support assistant time. Again, that is provision and not an outcome. So moving on to what the legislation says and sort of how outcomes fit into the EHC process. We describe an outcome as a benefit or difference made to an individual as a result of an intervention. Now, I said this at a training session once, and a lady very sensibly put her hand up and said, does that not mean then that we are focusing on the intervention? What I think the key takeaway is here is that this change, this outcome would not have been achieved for this child or young person without the intervention. If they'd been continuing on their trajectory as they were before this intervention was put in place, they would not have been able to achieve that outcome. So it's what we're supporting them to change with our provision. Oh, sorry, I just clicked on there. EHC plans must focus on education, health and care outcomes that will enable progress. There is a clear distinction between aspirations and outcomes. So aspirations, again, are that dream, that hope, and the outcomes are the sort of measurable steps to get there. They are personal and not expressed from a service perspective. So that picks up on some of those ones that were sort of provision driven. That is, as we say, not an outcome, but that's a sort of service provision. They're what needs to be achieved by the end of a phase or stage. Again, as I said, usually a key stage, so not necessarily. And aspirations and outcomes are not subject to appeal. You cannot tell a child or young person that this is not what they want. Whatever your role in the EHC process, it is never to tell them that. They are not subject to appeal. I'm going to go into now the CHUMs project. So this is a slightly odd acronym standing for Children Outcomes Measurement Study. I think they fudged that one a little bit. But this is a piece of work that CDC were involved in. Initially, it was about looking at whether patient-reported outcome measures, more commonly known as PROMs, could be used to measure the outcomes that are important to children and young people. And the short answer is no, they can't. But actually, what was more important to us in terms of findings is that it gave us a better understanding of the difference between how children and young people, their families, and practitioners see outcomes and where their perspectives differ. So what we found is that the different outcomes, they're really interrelated for these sort of broad concepts in life outcomes. And I'll come to that in a bit more detail, but they're really looking at these really big things. You know, I want to be happy. I want to have friends. All of those sort of big, broad brush issues are the outcomes that they're most focused on, and how the individual parts fit into those bigger outcomes. It's very complex and very individual, depending on different children and young people. Of course, you would probably anticipate that. And there are similarities and differences between parent and children perspectives. I will just say there are some sort of specific questions coming in. I will pick up on those after this, and I'll sort of respond to those and point you in the direction of any useful resources. So do keep dropping them in, but I'm not ignoring them if I don't respond to them. I will pick them up afterwards. So what do we find? As I said, children, young people and their parents have really big outcomes that don't fit into a single professional area or expertise. For example, being happy, being independent, having friends. Whereas professionals saw their outcomes in a much, much narrower way, focusing around sort of their area of expertise and knowledge. So around managing pain, teaching new skills, or improving functioning of a particular part of the body. There's a big gap there in between those, although there is some clear relationship. And what we wanted to look at is how do we bring those together so that those of you who are giving advice towards EHC plans from your own professional perspective can connect them into and see how they flow into those big outcomes that children and young people want for their own lives. So I'm going to show you a video now. I'm hoping that I have done this before and it has worked. This is Lucy Watts, who you may be familiar with. She's very active on social media and she pops up all over the place. She's talking about how her experiences and how joint working and the professionals coming together to focus on her outcomes improved her experience. There is a glitch at the end of this video that I've been struggling to work around, but by the time it gets to that point, we get a good understanding of Lucy's experience. So here we go. It seems that people have got video but no sound. Okay, I'll include this in the. Well, this did work last time I did it. I will include this in the link. So my apologies. I will share that separately. But essentially, what Lucy says is that the different when Lucy became very ill, the different professionals around her were really focused on getting her well, and when she was well, then she could go to college and then she could pick up her education. But she really felt that actually it was more important for her to be doing her education alongside her friends and staying, as she terms it, normal as possible, and sort of accepting that she wasn't going to get well, and she didn't want to wait and do it later. So then those around her sort of changed their approach to enable her to maintain her education as best she could. And what she really wanted to do was to go to college with her friends, which she did manage for a term. And she found that that was a real achievement for her, and something that was really important. And it was from her those professionals all working together that she was enabled to do that. So my apologies that hasn't worked. I will share that with you along with the follow-up. So what does this mean for practitioners? This is an example of another young person. We've called her Frances. It's not her real name. What she really wants is to go to the end of year disco. She wants to be able to do her own hair and makeup. She wants to dance with her friends, and she wants to chat to boys and get a boyfriend. So this is built into her EHC plan as her outcomes. So in terms of the professionals who are supporting her, what they are being asked to do with this sort of outcomes focus is to reshape the way that they're thinking about the interventions that they're providing. So for example, her OT is focusing on helping her do her makeup and then do her mascara and then do her lipstick, that kind of thing. Her physio is focusing not on walking but on dancing, and her speech and language therapist is framing their work around chatting to boys and getting a boyfriend. And feminist issues aside, hopefully someone's had that conversation with Frances. But it's not necessarily asking them to change what they do, but it's just asking them to reframe it and just think about it and approach it in a way where Frances can see that benefit for those outcomes that she's aiming for. And I'm not a physio, I'm not a speech language therapist or anything. But it's just about, so it may not change actually what they do with her on a session by session basis, but it's just shaping it so that she can see how it fits. And what this means is that you get better compliance actually, because they're seeing the purpose of it, and these children, young people, and families are seeing the value of the work that professionals are doing with them, because it's personal and it's more meaningful. So some general comments from what we see in EHC plans. Good ones have an understanding of the whole child or young person, as I've just mentioned, and their aspirations are clearly identified, and they are the golden thread that runs all the way through. So it's very clear how the outcomes are the steps towards the aspiration, the provision supports the achievement of the outcomes, and you can see the picture of how the provision all comes together to achieve those joint outcomes. So there isn't an outcome for health, there isn't an outcome for social care and so on. They are joint outcomes. The ones that aren't so good don't have those links, so you can't see that golden thread, and they have more of those targets like Hardeep and his 10 words rather than holistic outcomes. Or outcomes don't connect really into the rest of the plan, and there's sort of a disconnect between the provision and the outcomes. We can see some sort of manufactured outcomes where, and this comes back to what we've seen in templates, where sort of those who are giving advice are encouraged to write their own outcomes rather than the outcomes being developed holistically, and seeing how provision can be supporting these outcomes. So things are a bit, you can see very clearly that that's a health one, that's a social care one, that's education, so on. That's not great. And we can often see smart outcomes that are, sort of well written on paper, but it's not clear how they're relevant to that child and young person and their aspirations. There was a comment earlier about language. So here's a few language points. We often see some very, very vague outcomes. So for the example here, James will gain access to practical skills. What does that mean precisely? What practical skills is James gaining? Is it cooking? Is it mechanics? Is it, who knows what that might be? And gain access to, again, what is that? Is he going on a course? Is he, you know, learning through experience? It's just very unclear. So some sort of specific language things here. Access to, we've already mentioned. Regular is another one. Christmas is regular. Sundays are regular. There is a very big difference between Sundays and Christmas. So again, a bit more of that clarity, a bit more specificity around what do we mean? Is it weekly? Is it monthly? And so on. Opportunities for, very, very woolly. Well, again, what is that? And one here, able to versus does. We encourage the active language. And someone, again, there was a point earlier, someone mentioned about should it be framed in the future tense. What we're looking at is the sort of the outcomes of the gold at the end of the rainbow. So how do we know it's achieved? If we write it in that more active does, then that's when we know it's achieved, when that young person is doing that thing that has been set out. It just helps to make it a little bit clearer of how we identify that it's been achieved. So at this point, we would set people off on an activity with two. We have a young man called Sam who is 17 and a little girl called Ellie who is 3. And then we have a case study about them, and then we ask people to think about the questions that they would use with these young people. In Ellie's case, it's with her parents, to sort of understand their aspirations and their outcomes, and then an activity on writing them and having a practice about writing some smart outcomes for those children and young people. We're not going to do that now. Again, we have constraints of time that we usually would dedicate sort of half an hour, 45 minutes even to these activities. But this is what you would get if you were to have the full training. Then we move on to some tips about advice. Where relevant professionals are identified, they should complete the advice template, ensuring that the information is digestible and understandable and accessible. We know that the people who are putting together these plans and writing these outcomes are not going to be experts in all of your fields of expertise. So they really need to be able to digest this information and sort of know what to do with it. And if you're using very complex language and a lot of jargon, that makes it much more difficult for them. And I think also, again, the so what question here, if you just put a diagnosis, it's very unclear as to what impact that actually has on a child or young person's life. We know autism, for example, is a huge spectrum. I mean, we call it the spectrum for a reason. And one person's autism is going to affect them very differently to another. So actually what we need to understand is what impact that condition has on them, so that we can better understand how the outcomes and provision will relate. Again, recommending provision based on professional and clinical judgment, not on the availability of provision. This is one that makes people sit up a bit, I think, because obviously once something is in the plan, that is a legal document, and there is tension around promising to provide something that it is not possible to provide because it isn't already in existence. This is where you have to have some tough conversations about commissioning. If there is something that a young person clearly needs to achieve their outcome, regardless of whether it is currently available, it should be given, you know, and it's supported with the professional and clinical judgment, it should be given there. And again, advice should be limited to the area of professional expertise and remit. So we wouldn't have education professionals diagnosing autism, and we wouldn't have health professionals recommending a school. So do stick within the lines. We've developed here this pyramid, which I will share with all of you again after this. This comes from the Maslow's hierarchy of needs. Well, there's you've missed a step here, I suppose, in the CHUMs research that I shared with you earlier is represented in a pyramid, and we've overlaid the EHC plan onto that. So we've got that through flow from aspirations to outcomes, and then we can see how the provision underneath is supporting step towards those outcomes and that aspiration. So it's just a bit of a visual representation of that golden thread that I've mentioned a few times. I've had a couple of questions here. Question from Zoe: where is the best place to find good examples of EHC plans? We have an EHC plan exemplar that I will share with you, which contains a number of different examples for a very wide range of children and young people. And in terms of templates, we are at the moment collecting some case studies from existing from areas with existing templates that we can share as sort of good practice examples. And so I will include those at the link. I've also seen there's a very long comment that I will pick up on afterwards. At this point, we would go into some the key legal considerations. As I mentioned earlier, I'm not going to go into this in depth now because it is just sort of a re-presentation, I suppose, of what is in the code and how processes should look. And that is just, it's sort of setting the foundations for the following discussions. So again, that's something that I'm going to leave for the full training. And then we would have those discussions around our local processes and templates, enabling us to have this good practice to perform in this way. So that would be the end of the day. But what I'm going to move on to now is just pulling out some of the key learning from the various sessions that we've already delivered, and we have been delivering this for a couple of years now, so we've got plenty of learning to share with you. And as I keep mentioning, if you're recognizing these, if these look familiar, particularly the challenges, and you would like support, do drop me a line. I may well be inundated, who knows? But do drop me a line afterwards, and I will add you to my list. So some of the strengths around processes. I have never done a session where, so we tend to do this in different stakeholder groups, and we ask them to think about the strengths and challenges of their process from their particular perspective. And I've never done a session where a stakeholder group hasn't been able to come up with a positive. So the picture can sometimes look quite bleak, but actually when we really get people thinking about it, there is always good stuff out there, which is really encouraging. Communication between agencies is improving. The more that this sort of shift towards outcomes, both at the personal and the individual and the strategic level, is being taken to heart, the better the communication is getting. We're also seeing that young people's voice is increasing. People are seeing more that the aspirations really are focused around young people and the outcomes are getting better. A lot of areas are exploring live portals. A lot of the challenges are around not seeing the plans at various stages, not knowing what a young person's aspirations are before you're asked to give advice, not seeing the draft plan afterwards, and not knowing if your advice has actually been reflected in the plan. A number of areas are looking at various different systems for working on that. So Liquid Logic and Capita come up quite a lot. We are working on a case study. We are working on a case study with Islington at the moment, who are sharing their live portal sort of write up with us, and we will share that as soon as that's finished. Next, the good outcomes are transferable. So that again, that's just reflecting on. I've taken that as that's wording from a write up, but that's just that they are holistic and that they're not owned by one particular agency. I mean, in some areas, we're seeing some really good alignment with other processes. So looked after children and children in needs processes, and bringing the EHC plan in with those is really strengthening, as well as improving efficiency. It's sort of strengthening understanding of that child and young person. The challenges, I'm sure you're aware there are many of them. Capacity, we've already mentioned across the piece, capacity is a problem, infrastructure is a problem. Something we hear quite a lot, which worries me. My background is in children and young people's voice, and particularly with those who are non-verbal, my favourite group to work with. There is still a wide misconception that non-verbal children and young people cannot communicate. We have a load of resources we can point you in the direction of there, and I will include some again with these slides when I send them out, because that certainly is not the case. Not all partners are kept up to date when changes are made to plans. Again, this comes back to that live portal being really useful to make sure everyone's on the same page. We hear that, you know, Senkos aren't sure what's happening when they've made a referral and all sorts of things. So again, keep an eye out for that Islington case study. We've looked at quite a lot of templates, which are confusing. People aren't quite sure what information they're supposed to be including in them, or they're not conducive to best practice. So they're asking people giving advice to write outcomes for children and young people rather than giving advice which will then be built into holistic outcomes. We did some work in one area where every different agency had a different advice template, which I imagine was a nightmare for those who were trying to coordinate it. So having one clear holistic template is really helpful. We often hear that particular agencies aren't giving input, and that varies from area to area, and there are always reasons for that. So I don't want to blame anyone there, but this is just what we're hearing. This is a big one, I think. Advice givers are not always aware of the child or young person's aspirations. It's very you can't have that golden thread running through if they don't have that oversight at the very top level. And again, that sort of comes back to information sharing. I've just had a note here. I've had a couple of notes, some which I'll pick up afterwards, but this one here, just wanted to clarify, as OTs, physios, we shouldn't be writing outcomes for children. We should be offering advice, and SEND should write the outcomes. Yes, the outcomes should be holistic. So you should be able to see the coordinators should be putting together, and you should be contributing to understanding that child or young person's outcomes. They should be involved in the development of the outcomes, and you are contributing towards those. The draft plan often not shared with advice givers. We hear this a lot, and then when the plan comes out, people are, you know, their advice has not been fully reflected, or it's been misunderstood. And annual reviews, the quality of those is still quite poor. I think people are putting a lot of time and effort into improving EHC plan systems, and the annual reviews are sort of the second step. But that's something that we may want to pick up on in the next year of the contract as a sort of major theme. So templates, I've already sort of mentioned this. The templates that are working the best that we've seen are having one central pro forma, which has been co-produced with practitioners to so they understand what the information is they're being asked for and what format it is best to give it in, so that everyone who is giving into that advice template and everyone who is receiving advice via that template knows what they're expecting. Some of the challenges we've seen, again, I've mentioned this already, not actually having a standard pro forma and lack of clarity over what is being asked for. And I've already mentioned those which sort of encourage service level outcomes rather than holistic. So that has been somewhat of a whistle-stop tour of a very long and busy day, condensed down into 55 minutes. Okay, I've had a few comments. I'll respond to the comments with our EHC plan good practice guide, rather than picking up on these individually. But thank you for joining me this afternoon and for your attention. If you feel that this training would be beneficial for your local area, please ask a senior leader to contact us, and we can set this up going forward. Thanks for some nice compliments about the webinar experience. Thank you, everyone. So yes, please do get in touch. There are my contact details. I am Philippa P. Watts, or my colleague Ryan will also pick up on any. We will send all of the slides to you and all the various materials and things that we've referenced today. Please do share these with colleagues, and anyone who signed up, as I say, but wasn't able to attend will get a recording of this webinar. So thank you. Enjoy the rest of your afternoon, and stay safe and stay cheerful. Thanks very much.